It is a pleasure to receive an invitation from 7th International Webinar on Cognitive and Behavioral Neuroscience. My name is Jiang Mingzhu, and my mentor is Mrs. Wu Shan. We are from the affiliated hospital of Guizhou Medical University in China. The theme I want to share today is impact of white matter hyperintensity and age on gait parameters in patients with cerebral small vessel disease. And these have been published in JAMDA in this year. I will complete today's sharing from the following 4 aspects. First, cerebral small vessel disease means CSVD is a common chronic progressive disease that involves damage to the arterioles, venous, and capillaries of the brain. No-extremity motor function impairment is one of the most common complications of CSVD. Gait disturbance and balance disorders are the most common type of motor function impairments in patients with CSVD. Secondly, in sporadic arterial sclerotic etiologies associated with CSVD, gait disturbance is a significant predictor of falls, disability, and even death. With the revolution of gait analysis techniques, quantitative assessment of gait parameters in patients with CSVD is available. The increased variability of gait parameters, including slowed gait speed and step frequency, shortened step length and widened step width, and prolonged stance and swing times, are important clinical signs of relative gait disturbance. However, quantitative gait parameters, including spatial and temporal gait parameters, spatial gait parameters, and temporal gait parameters, are difficult to obtain for some clinical doctors. Therefore, it is necessary to identify relevant information that can infer gait disturbance in patients with CSVD. CSVD is commonly ascribed to a series of neuroimaging manifestations, consisting of recent small subcortical infarcts, leucemia, white matter hyperintensity means WMH, cerebral macrobleeds, enlarged perivascular space, and brain atrophy. WMH, a major imaging marker of CSVD, has been considered as a pathogenesis of gait disturbance. In addition to WMH, previous studies have demonstrated that the occurrence of gait disturbance increases with age. In this study, we investigated the effect of WMH and age on gait parameters. This is the follow chart of participant recruitment for the analysis of gait parameters. Eventually, 883 patients with CSVD were enrolled in our study, including 553 patients with Physicus 1, 257 patients with Physicus 2, and 73 patients with Physicus 3. Moreover, 193 healthy controls who had completed physical checkups during the same period were enrolled in our study. The physical score of patients with CSVD were used to assess the burden of WMH. Gait parameters including step speed, frequency, length, width, stance time, and swing time, were quantitatively assessed using a vision-based artificial intelligence gait analyzer, means cell system. The relationship among the physical score, age, and gait parameters were analyzed. The total study population consists of 1,017 sex participants with a mean age of 61 years. 62.09% were female. The characteristics of the participants included in this study are presented in Table 1: age, sex, height, weight, past medical history of hypertension and T2DM, and family history of stroke were significantly different among the four groups. However, there was no significant difference in body mass index, past medical history of dyslipidemia, person history of smoking and drinking. Table 2 presents the gait parameters of the study population. 5 gait parameters, including step speed, step length, step width, stance time, and swing time, were significantly different among the four groups. However, no significant difference in gait frequency were found among the four groups. Moreover, 5 box diagrams that displayed the changing tendency of gait parameters among the four groups are shown in Figure 2. With an increase in the severity of WMH, the worse the performance of gait parameters. Table 3 shows the effect of WMH and age on gait parameters. According to the results of linear regression analysis, physical scores and age were both associated with gait parameters, including step speed, step length, stance time, and swing time. The physical score were associated with step width, whereas age was not. Age was associated with step frequency, whereas the physical score were not. The physical score and age were still significantly associated with partial gait parameters after adjusting for sex, height, hypertension, T2DM, and dyslipidemia. 2 scatter plots, linear fit, which show the relationship between physical score, age, and gait parameters, are shown in Figure 3. With an increase in physical score, gait parameters worsened, including a decrease in step speed and step length, and an increase in step width, stance time, and swing time. In this study, we found that WMH and age were both associated with gait parameters in middle-aged and old adults. The higher the physical scores, the worse the gait parameters, including a decrease in gait speed and step length, increase in step width, stance time, and swing time, excluding sex, height, occupation, age, and walking patterns. Complex gait control requires the integration of information by neural networks. A possible mechanism of this role is dysfunction of rich club connections. White matter is largely composed of miliated axons. The militiates insulates the axons to increase the speed of electrical signal conduction. The extent to which the brain can efficiently transfer information between regions depends on the integrity of white matter. Proper gait requires the integration of rich club connections. The lowering of rich club connection strengths results in detailed, well-written gait performance, particularly in WMH. In addition to WMH, Table 3 also shows the general association between age and gait parameters. We found that most gait parameters worsened with increasing age. This result is in line with studies in community-dwelling older individuals. Age affects not only WMH, but also gait parameters independently. Our study had several limitations. First, all patients in this study came from the south of China. Therefore, the results may present bias. Second, 82% of people older than 85 years present with gait disturbance due to osteoarticular or neuromuscular pathologies. Muscle weakness is very important for maintaining gait function in old populations. Hence, a lack of assessment of muscle weakness is required in further studies. From a clinical perspective, our observation suggests the importance of WMH and age. These factors could be useful for maintaining gait function in old populations. Multiple interventions to prevent the progression of WMH are needed in old people. If so, doctors and patients must stay alert to relative falls, disability, and even death. This information can be easily used by a primary practitioner rather than using complicated gait parameters. That's what I'm sharing today. Thanks.